Hello, everyone. My name is Ballata Tamasgan. I am the Director for Cash and Market-Based Programming for World Vision International, based in Washington, D.C. area. We are happy to host this important session together with the Cash Learning Partnership under this title, From Crisis to Resilience, the Role of Cash and Voucher Assistance in Humanitarian Reset. So we have quite a number of good speakers from different, of course, countries, and looking forward to have this session together. We have Kate Turton from CALP. We have also, she's a director. I think I will introduce them when they speak. And we have Tata Mekaladis, and we have Kimran, Shivan, Hussein Barish, Rahat Aminor, and Rana Nasser. Of course, we have also Amanal Shahada with me. I will briefly talk about their roles later as they start speaking. But I just want to say a few things before we start. And we're doing this in the midst of course, humanitarian reset happening. Of course, since last year, we are in a different phase. We all know that. We just want to make sure that the role of cash and voucher assistance to continue to be amplified as an important and perhaps the default response in our humanitarian interventions across different countries. Before I also actually jump into the presentation, I just want to recognize that we are in the middle of crisis happening in different parts of the world. As you know, we have Sudan, we have crisis happening, and we have in the Middle East, Ukraine crisis, of course, and Gaza, and now, of course, the past few days, as you all following up, we are in a different crisis phase. We just want to acknowledge that, and we are deeply concerned, of course, what's happening in there, and with the recent escalation in the region. And of course, our thoughts and prayers are with all affected humanitarian staff, as well as the children and families that we all serve. With that note, World Vision is committed to continue to use cash and voucher assistance as a modality. We do have cash roadmap, a global roadmap that's basically guiding our work globally. We have still that commitment to deliver cash up to 55% of humanitarian assistance, and we still believe that it's an important tool, important modality. And of course, collaborating with CALP and with other actors is also critical, particularly at this point in time. So with that note, I would like to invite Kate to do an opening remark, but also to give us really a global picture on cash and voucher assistance. And Kate is a director of CALP Network. Most of you know her, but even though you see her for the first time, Kate will take us through this important part for the next 7 minutes. Kate, over to you, please.
Yeah, thank you very much, Baletti, and many thanks for the introduction. And yes, also sending my best wishes to all colleagues, particularly across the Middle East and Central Asia at the moment, at this difficult time. And I'm delighted to be here with friends, including some old friends that I've worked with on the panel as well. So yeah, really, thank you very much for that invitation. I'm just going to give, as Baletti says, a few minutes just in terms of that global picture and perspective, then hopefully to frame the conversations that we'll have. And I'm really looking forward to the discussions today. So I think at CALP very much, we're really thinking ahead at this really critical juncture and thinking about how do we secure the future for cash and voucher assistance. I think we've made, as a community, incredible progress over the last 15 to 20 years. And we need to now look ahead and really think about how do we build on that and how do we take cash and voucher assistance to that next level in a really, really challenging, volatile landscape. So I'm going to just say a few words about that today to frame the session. Next slide, please. So, I mean, I think the purpose of this slide really is to sort of, I guess, convey the message that we've always said that cash and voucher system,
الشريحة دائما قلنا بأنه المساعدة
its relevance in terms of people-centered design, in terms of putting people at the center of humanitarian action, its kind of advantages as an efficient modality that supports and reinforces local markets, all those arguments that we've made over the last, I guess, 10 to 15 years, you know, and we've won a lot of support for those arguments. But I think what we are now thinking about as we look ahead, that if cash was really important in the last 15 to 20 years, it's even more important now as we look ahead. And it's even more important for a number of really key reasons. And I think as collectively as a community, we need to refresh that argument for cash and make that point that cash and voucher assistance is even more relevant than ever in the very challenging context that we face. So there's a few points here really about cash, its relevance going forward, its relevance in delivering on the reset ambitions, which we've all kind of, you know, heard about and are trying to engage with. And there's a few points here just to emphasize. We've always made the point that cash is that ultimate people-centered response to support people in crisis. But I think we also now recognize that in terms of the really challenging humanitarian landscapes that we find ourselves faced with, in terms of that volatility, that kind of, you know, consistent violations of international humanitarian law, the breakdown in those norms and so on, that giving people choice and dignity in those really, really difficult contexts is actually more important than ever. And that sense of agency for people who will feel very vulnerable and disempowered in these chronic crises that we've just been talking about, it's even more relevant than ever. So that argument around agency and choice and dignity for people to enable them to navigate those volatile contexts within which we're living in and recognize there's only so much that the external community can do. We've talked a lot about localization over the last 5 to 10 years and fallen short on many of those commitments. And again, we know that cash can be a real catalyst and driver for that locally led humanitarian action and that locally led response. So rooting our cash and voucher assistance in the local context and supporting locally led response, again, means that cash has an important role to play. There's a few more points here. I won't dwell on them, but we'll be picking up on this efficiency point in a bit later. But that efficiency of cash is so much more important, again, in that context of declining resources that we face ourselves with. And then the last 2 points, I think, are really the opportunities, maybe, in as we look ahead. And this sense that we're increasingly seeing from around the world, and especially across the Middle East, North Africa region, this the innovation that's happening around cash, the idea that you can now get cash and voucher assistance into really tough contexts as a preferred modality with a lower risk is, I think, really exciting in terms of reaching those most vulnerable as we look ahead. And that continuous innovation that's happening around cash. I like to sort of use the comparison with in-kind transfers with food, that there's a limited amount you can do to innovate. You have a sack, you can cut it down into different sizes, you can maybe grind it differently, you can fortify it, but ultimately it's limited in terms of innovation. But cash is ultimate. I think in terms of the scope for innovation is unlimited. And again, I think we need to be sort of setting that out and getting behind that innovation and driving it forward. So I think looking ahead, you know, let's evolve our arguments for cash. Let's bring them right up to date for the landscapes in which we're operating within, with the opportunities that cash offers, and of course link that back to the reset in terms of a means and modality for driving forward the key outcomes that are set out in the reset, and a sense probably that some of us are quite worried about in terms of whether we're actually going to live up to the rhetoric that has been set out. So the next slide is just a few points to give you that global perspective to frame the discussions today. So despite that relevance of cash and voucher assistance, despite its relevance to the future ahead, we have had data in the last few years about cash and voucher assistance losing ground. So this is the latest data we have from 2024. It shows that cash is losing its ground at the global level, both in terms of volumes, not surprising, because we're seeing limited resources, but also in terms of share of humanitarian response, which is really not a great place to be, particularly given we're trying to make the most of what we've got and cash is more efficient. But I think that's the kind of, really challenging global picture. What we at CALP are trying to do a little bit is dig underneath that. I think there's a lot of noise a lot of variation or granularity in cash and voucher assistance when you come down to country level, when you come down to specific crisis contexts. And I think we feel a little bit more optimistic that at that global picture, there may have been some lost ground, certainly in terms of some big responses that have driven that global picture. But in many contexts, and including, as I said, the most difficult ones, cash is still very much alive. And in fact, across countries such as Afghanistan, Myanmar, I was in East Africa last week talking about Sudan, Somalia, and even now in South Sudan, we see cash and actors committed to taking that forward. So there's some really kind of interesting nuances sitting underneath that global picture. And that's where the opportunities are that we should be focusing on, and understanding where those blockages are that we might be able to help unblock. So again, let's keep our eye on that global picture, but also really see the opportunities across, particularly across the region that we're talking about today, where cash is really proving its value and that innovation is opening up new opportunities. So the final slide for me is just to sort of, I guess, give you a little bit of sense of how CALP is thinking about the future. We're really trying to think about the future for cash, the future for the CALP network as we navigate these really difficult, challenging contexts that faces us. And we are really trying to think about how do we, I guess, on those three pathways on the right-hand side of this slide, how can we support a pathway for cash and secure the future for cash and voucher assistance in the future ahead? So we will be working very hard in terms of that pathway one, to really step up our advocacy, step up our visibility in terms of making that case for cash and voucher assistance, building a more diverse set of supporters, both political and in terms of funding, to really kind of, take cash to that next level. So we will be really trying to invest in that more bolder, visible advocacy for cash, and seeing ourselves as playing a critical role as a network and with you all in taking that advocacy to the next level and being a bit more strategic and targeted about it. We are also thinking about that, the quality, the cash quality agenda. CALP obviously has played that critical role as the kind of custodian of quality, the custodian of technical standards and guidance, but we really need to take that kind of set of issues around the quality of cash and ensure it's fit for purpose for some of the challenges ahead. So streamlining that guidance, supporting innovation, convening our partners and the network around the key lessons that are emerging, so that we really drive forward a new era of streamlined, people-centered cash that's really fit for the next 5 to 10 years. So I think we can all say that what happens in the next 5 to 10 years, cash will look very different than it did for the past 5 to 10 years. So let's really come together, pull out those lessons, develop the guidance that can support it, and really kind of drive that innovation. And then the third pathway for us as CALP that we will be really focusing on over the next 3 years is really trying to deliver on the commitments we've made around localization, but really focusing in on locally led cash as an entry point into delivering on those commitments that we've so far failed to deliver. So we will be forming strategic partnerships with local and national actors and some of the networks, the members of our network. We really want to kind of understand some of the really practical constraints that are operating, and develop, of course, continue to invest in the capacity and have a really strong offer in terms of building capabilities and capacity of our local and national actors to drive forward locally led cash. So 3 kind of pathways through which we will be working, looking forward to working with you all across the network, to partnering with you all, to finding those opportunities, because I think there are huge opportunities ahead. And I think the wonderful thing about cash and voucher assistance is it will always be relevant. It will always be the best thing to do because it's a people-centered, it's the preference of the communities we're seeking to serve. And we may have bumps in the road, but ultimately, I think we all share the common goal, and I think it will go from strength to strength with the support of us all. So many thanks, as I said, for inviting us. Belete, thank you very much for chairing us. I'll stop there. There's many more interesting speakers to come.
Belete, before you start, the kind reminder to our attendees that Arabic translation is available, and please, if our speakers can speak a bit slowly so that our interpreter can manage. Thank you so much.
Very good. Thank you so much for that reminder. Yes, and thank you so much, Kate, as well, for a wonderful presentation and high-level updates where things are, and particularly also where CALP is heading to. And with all these, cuts and the graphs that you have seen, it's very important that cash is amplified, and that's where we can even use the available resources more efficiently to address the needs of the most vulnerable people. And I think that's very important. So with that note, we'll transition into the next speaker. Rana Nasser will take us through the recent studies on the efficiency of humanitarian cash study. Rana is regional representative for the Middle East and North Africa at the CALP network. Rana, over to you.
Thank you, Belete, and good afternoon, everyone. So as Belete said, I'm going to take you through some of the main findings of this report that CALP has developed at a global level. So if you can go to the next slide, please. So when we were thinking about this, we were thinking about what our core question for this is, and given kind of the context with the funding cuts, with the humanitarian reset, we really wanted to kind of refresh the evidence on how we maximize the impact of every dollar that we spend on humanitarian assistance. So that's the main question that we had when we started looking at this research. So we looked at different cost drivers of humanitarian programs. So we looked at modality, what modality is being used to deliver aid. We looked at levels of risks in the different countries or regions that the aid is being delivered in. We looked at the type of delivery partners, and then we looked at different data like IPC data, etc. So different resources and different data points were used to look at the cost drivers of humanitarian programs. And what we found is that what had the largest impact on efficiency was the modality choice, and I'll talk a little bit about each one in a minute. So modality choice, the type of delivery partner, and scale. So we found that these have far larger impact on program costs than, for example, conflict risk or for example, infrastructure that is present in a certain country. And at some level, this is something that's good, because these are things that are in our control versus, obviously that we cannot control conflict as we, most of us are living in now. So next slide, please. So first I'll talk about the modality choice. So we looked at different types of modalities of delivering humanitarian assistance, and the biggest difference that we found was between the efficiency of delivering multi-purpose cash assistance versus in-kind food, and we found that MPCA is 37.5% more cost efficient than delivering in-kind food. So we also looked at vouchers, we looked at sectoral cash and different types of modalities, and this is the biggest difference. So it showed that multi-purpose cash assistance is the most efficient modality to deliver humanitarian aid. And then next, I'll talk a little bit about scale. So if you look at the graph on the left-hand side, which is looking at the scale of multi-purpose cash assistance programs, and towards the very left of it, it looks at very high efficiency gains as you scale programs, and then it stabilizes a little bit, versus with in-kind aid, where even if you scale programs, not a lot of economies of scale are realized, and in part that's probably because in-kind programs are already large. But just looking at this graph, it shows us that there's no one answer of what a large-scale program is. So obviously it depends on the context and the delivery partners, etc. But we found that the greatest increase in efficiency when looking first, that MPCA programs are more when at scale they are more efficient to deliver than in kind, and the greatest efficiency is found when we scale smaller programs to become a bit larger. The next slide, please. And then lastly, looking at the delivery partners. So we used weighted averages that reflected program scale across different delivery partners. And overwhelmingly, it was found that local and national organizations showed the highest transfer efficiency across these different partner types that you see on the graph. And then you see here that with the Red Cross, Red Crescent movement, we excluded one significant outlier, and that's the Turkish Red Crescent's ESSN program being implemented in Turkey. And that was done because it is a very large program being done with government, and it skewed the results. So I just wanted to note that one. So delivering through local partners is more efficient. So what this tells us, and thinking about MENA in specific, so we looked at the data within MENA and in different regions, and that the report found that efficiency outcomes in MENA are broadly in line with the overall median of efficiency. So MENA's doing well overall in terms of efficiency outcomes. However, it's really difficult to compare results between different regions because there is a lot of variation in the operating environment. So you can't compare MENA with Sub-Saharan Africa or with East Asia, for example. So just to keep that in mind. So two main recommendations is first to scale what works. So obviously scaling CVA programs, specifically MPCA programs, and particularly through local and national organizations can generate substantial efficiency gains. So that's kind of one of the main messages. And then for all of us to look at high performing combinations. So we're looking at prioritizing cost efficient partners, and then we're looking at kind of different CVA modalities and pooled funding mechanisms and how we can unlock kind of large savings. And on pooled funds in specific, and this data I think specifically was from the SURF, that if we do utilize these modalities or these funding mechanisms, we can achieve savings of between 1.1 and 3.3 billion dollars. A little bit more on MENA. So while I was preparing this presentation, thinking about kind of the different programs, so I mentioned already the ESSN program that the Turkish Red Crescent is running in Turkey. So that's obviously a large program that is being done in collaboration with government. So that has high efficiency gains. We also have obviously large refugee cash assistance programs, primarily being delivered by UNHCR and WFP. And then the report also found that the longer that the programs are going, the more efficient they become. So that's also another responsibility for us to keep, challenging ourselves, reflecting on how we can maintain these efficiencies. There wasn't a lot of data overall or good data overall on consortia, but that is something else to keep in mind. And then I was thinking a little bit about, for example, the Common Cash Facility in Jordan, where organizations come together and they contract one service provider to try and reduce transaction costs. But again, the report found that transaction fees are not the biggest cost driver. So in fact, the largest cost driver that was found to be targeting. So that emphasizes the importance of getting targeting right in cash and voucher assistance programs. For example, looking at existing data, making sure that the targeting is done right to use the resources that we have the best way possible. So this is a very huge report. I tried to kind of condense some of the information in this presentation, so we plan to publish the full report in April, so hopefully a month or so from now, and there will be more details to follow then. Thank you.
Thank you so much, Rana. I know that quite a number of good lessons will be part of the report, and looking forward for everyone actually to learn and more apply those learnings. This efficiency, as you can see, it's been overwhelming evidence on the efficiency of cash and voucher assistance in general as a modality. 30%, now you can see it's 37%. So this is something that we can learn as humanitarian community, as NGOs. So this is really a good evidence for us even to continue to advocate at different level. Again, thank you so much. And then with that note, let's continue to the next presentation. The next one will be from Tata. Tata Mekladez will share another findings, another study that World Vision did in the Middle East, in the MER region, in the Middle East and Eastern Europe region, as we call it, and she will take us through those findings. And Tata is the Regional Impact Director for World Vision in the Middle East and Eastern Europe region. And Tata, over to you.
Thank you so much, Belete, and greetings, everyone. It is delightful to be part of this very interesting conversation with very interesting audience. As Belete just mentioned, I would like to, in a very short time, try to present a very large study that World Vision carried out, what we call cash waves study. And next slide, please. The study had few core objectives that we tried to look at. First of all, we wanted to generate evidence-based and learning for around the impact for further scale-up as part of World Vision programming in Middle East and Eastern Europe under CVA. And then the core objective of the study was to explore impact of the cash and voucher programming on the areas like mental health, social cohesion, child well-being, livelihoods, and gender equality. These are the areas that we felt are under-researched as part of the CVA modality, and wanted to see what are, though some of the anecdotal evidence of course exists, we wanted to look, take more kind of research approach to see how CVA impacts these outcome areas. And then finally, the third objective was to use the findings of the research to promote inclusive complementary donor approaches and better leverage the existing resources. Next slide, please. The study was carried out in 2024. However, the findings are very much relevant still in the context of the humanitarian reset. Very briefly about the scope of the research. So we looked at our CVA portfolio across 8 countries, including Afghanistan, Georgia, Iraq, Jordan, Lebanon, Romania, Syria, and West Bank. And as you can see, these are very diverse contexts. And we looked at the affected groups, different demographics, but also these different types of displacements, like internally displaced communities, as well as refugees and returnee communities in these 8 countries. And the research deployed both qualitative and quantitative methodology. Next slide, please. I'll briefly take you through some of the core findings across these 5 domains. So let's start with livelihood and resilience. As probably didn't come as a surprise that cash improves short-term financial stability and reduces vulnerability. But then if it's integrated with vocational training and financial literacy, it can support also long-term resilience among the affected and displaced households. The study affirmed that the multi-purpose cash assistance can improve the creditworthiness and access to informal loans, which was also quite important factor into building the resilience of the families and households that we work with. Women recipients often demonstrate strong financial management and investment in family welfare. And very importantly, long-term CVA supports income-generating recovery decisions. Next slide, please. Gender equality and social inclusion. Again, it was affirmed by the study findings that cash transfers to women increase autonomy, dignity, and financial decision-making power, both at the household and the community level. And women often tend to allocate funds towards education, livelihoods, and long-term needs of their family members. Looking at the financial, coupling the cash transfers with some of the financial literacy and self-help group approaches enhances longer-term empowerment outcomes for the households, and particularly for the female and women recipients of the assistance. However, of course, there are, as we look into the gender perspectives of CVA, there are a number of the risks that we need to be very careful with. Of course, poorly managed targeting can lead to increased tensions within the households and can expose to the increased GBV risks. And of course, we need to also keep in mind intersectionality, like legal status or disability, which remains to be an important or a critical challenge sometimes in terms of the final outcomes and even access to some of the critical services. Moving forward with community cohesion, the next outcome area. As I've said, or maybe I forgot to mention in the beginning, that we looked at the different modalities of CVA. So we looked at the cash for work, restricted and not unrestricted cash transfers, and cash for work initiatives, as per our study findings, has proven to significantly strengthen collective goals and shared infrastructure outcomes. And if we when working in smaller communities, targeted assistance can really be a good incentive and a stimulator for local business and enhancing the solidarity in the communities. And inclusive coordination with local authorities, of course, reduces further tensions related to targeting and in other areas of the CVA program. In terms of the risk and challenges, again, targeting is again the critical factor. And we need to be very careful to not increase, not position the people and not further increase the resentments into the communities, because especially if we're looking at the protracted crisis, it can become a source of tension between host and refugee communities. The research, as you've seen, took place in some of the countries where the host communities mostly are also facing quite difficult living conditions due to the protracted crisis, the climate impact, failed government services, etc. So very important factor depending on the context that we're working in. And of course, data protection needs to be at the core of all the interventions, as it can pose additional risks to high-risk vulnerable groups such as women, returnees, refugees, or others. Next slide, please. In terms of the mental health and psychosocial well-being, as affirmed by the study findings, cash enables households to meet basic needs, reduce anxiety and household tensions. Of course, also with the ability to pay debt or ease up some of the immediate financial pressures. This can reduce protection risks and stress at the individual, household, or community level, and reduce financial strains, also decrease internal household conflicts. We have seen that over 90% reported feeling more secure, experiencing improved well-being and reduced stress, and with women showing slightly greater benefits than men. But we've seen really higher differences across the different target groups. So refugees and IDPs reported that with the support of CVA, they have improved access to some of the mental health services, while for returnees, access to MHPSS services have remained to be challenging. Next slide, please. And last but not least, the final domain or the outcome area that we looked at was the child well-being. Again, the study affirmed that CVA plays a critical role in reducing household stress, enhancing family stability, reducing negative coping mechanisms, and supports children's development. It significantly enhances children's well-being through positive changes in access to services, nutrition, health, but also education, which is another very critical factor for us. As in most of the conflicts, children or the displacement situation, children do experience interrupted access to development or educational facilities or learning processes. So you can see on the right side of this slide the percentages or the perceived improvements reported by our recipients. Next slide, I would like to very briefly summarize some of the recommendations based on our study findings. So again, to reiterate that gender-sensitive approaches and embedding the gender-sensitive approaches across all the different cycles of the CVA program is critical, starting from the assessments, targeting, monitoring, because as it was confirmed by the study, that all the different age groups and the gender groups experience different outcomes of the impact from the CVA program. Unconditional transfers really shift the decision-making power to affected communities and enables them to prioritize their own needs and lead local responses, including local partners and local partnerships in general by both local NGOs, but also communities themselves, as well as the local governments and other local actors in defining the relevance, targeting accuracy will lead to more sustainable impact and reduce the risks associated with the CVA program. And CVA works best when it's layered with multi-sector sectoral support. And I think this is very critical as we speak about the humanitarian research, reset in general, the reduced funding in our sector, but also as we talk about more sustainable outcomes through the different programming that we deliver. Alignment with the government policy directions and social protection systems where possible and where feasible enhances sustainability and also predictability of the cash assistance, and then also has positive longer-term outcomes on the for our participants. And finally, using digital tools to increase scalability, transparency, and beneficiary management, it is critical, but we shouldn't oversee the accessibility and inclusiveness of those systems as we design our programming. And just the last slide final slide from my end to summarize our findings, but also to link it to the humanitarian reset conversation that we are all having at the moment. And I'm very happy to see that everything that I have on this slide is pretty much resonates with what Kate was sharing in the her opening remarks, that when we're facing the changing realities where funding is shrinking, and we have short-term funding, there are overlapping protracted crises, and we are all driving and committing to increase localization expectations. We need to move more, stop seeing CVA as a delivery modality, but rather start looking at it as a stabilization and transition tool that's used not only in emergency responses, but is used for more sustainable and longer term impacts for our communities, so that we move away from just immediate relief to more system stabilization approach as we think about the CVA. Next is around moving away from standalone transfers and layering with other resilience models. And under the current funding constraints, humanitarian actors we can't afford anymore to do fragmented programming. And how can we challenge ourselves to align more directly with breaking the silos and prioritizing resilience opening oriented programming? And as we've seen by the findings of the study, that in order to achieve more sustainable outcomes with the CVA programming, layering it and coupling with different either targeted protection programming, education programming, or livelihoods programming leads to the best outcomes. In the context of the shrinking finances, cash becomes a mechanism for restoring disrupted social agency. And it stops being just a transfer modality of resources to the affected communities. So moving, even though we're saying, and we will continue to say, it's the most efficient operational modality, it is also the strategic tool that we have as humanitarians to enable most adequate but also longer term support for the communities we serve. And then finally, to leave everyone with the thought that CVA should therefore be positioned not only as an effective modality, but as a core strategic lever for resilience building in protracted crises, which unfortunately we have too many at the moment globally. As I've said, the study is quite large and looks in depth into the different outcome areas that I just gave you just a peek of the iceberg of. And here is the QR code that will lead you to the full report. Thank you very much, and back to you, Billet.
Thank you so much, Tata. Thank you. It's wonderful. As highlighted in the reports, we've been using MEPCA in the emergency response in all these contexts, but also in the recovery and resilience building. And the research really highlighted quite a number of good areas in different sectors, including even mental health and children well-being, WASH, livelihoods. It touches quite a number of sectors, and just want to encourage you to look at the reports. We've been using this report in other contexts, in other regions and countries. It's very relevant for your programming, but also as an evidence for your advocacy efforts. So I just want to encourage you to download the report from World Vision website, and then you can refer to that. That is very in a 7-10 minute presentation on that 8-country study. It's definitely difficult to cover everything, but Tata, you did very good to summarize those findings. So with that note, we'll transition into the next presentation. Next, Kamiran Shivan Othman will share us the experience from Iraq, a country-level experience with, again, the findings and reflection on what the humanitarian reset can learn about transition and coordination. So it's been on the efficiency part and then more the impact part. And now let's look at the coordination aspect. Kimran, over to you. And Kimran is the Director of Programs at the Rwanda Foundation for Development in Iraq.
Thank you so much, Billet, for giving me this opportunity to share some reflections from Iraq. Indeed, over the past several years, Iraq has gone through an important transaction in how cash assistance is coordinated. As the humanitarian architecture began to scale down, actors had to rethink how coordination should continue in a context that's moving gradually from emergency response to our long-term recovery and development. So today, I'm very pleased to share some few lessons from this transition. In particular, I will focus on three main areas. First, how coordination evolved from the cash working group to the Iraq cash forum. And the second, how localization became more important and necessary during this transition. And last, the third one, how the role of cash assistance, especially in MPCA, has been developed. Yes, please, next slide. This timeline shows how coordination around cash assistance in Iraq evolved over the time, over several years. Between 2019 and 2021, the cash working group played a very, very strong role in harmonized technical approach. During this period, agencies, UN agencies, international organizations worked together on the key elements such as targeting approach, transfer value coordination, calculations, PDM, post distribution monitoring tools, price monitoring systems. So all these help create consistency across different actors implementing cash programs in Iraq. And then late 2021, an important step happened. The cash working group organized a workshop to rethink the role of multi-purpose cash assistance. The discussion moved beyond emergency response and started exploring how cash assistance could connect to longer system or durable solutions. And in 2023, early 2023, the broader humanitarian coordination structure in Iraq began to wind down as the context stabilized. As a result, many programs started repositioning themselves toward development and recovery approach. So from that point and onward, the Iraq Cash Forum's ICF took an important role in adapting MPCA guidance and coordination mechanism to fit this new context. Next slide, please. The early shift, I mean, the start transition early. One of the most important lessons from Iraq is that the transition should start early. In Iraq, the shift from cash working group to ICF worked well because actors began discussing the future of coordination before the humanitarian structures was fully closed. The MPCA workshops in late 2021, as I said, became a turning point. It helped stakeholders, organizations to rethink about the cash assistance, not only as an emergency response tool, but also as in something that could support longer-term recovery and stability. Next, please. Another key lesson is that the transition should not be treated as replacing one system with another. The Iraq Cash Fund did not start from zero. Instead, it built on a technical foundation that the cash working group has already established. So this included harmonized tools, shared approach for calculation, for calculations, common monitoring practices. What changed was not the technical foundation, but the purpose and direction changed. Next, please. In transition context, coordination usually operates with fewer resources and less formal structure. Iraq's experience shows the coordination can still be effective if the governance model is simple and focused. Two things here I would like to highlight it. First, coordination must be clear what it does coordinate. For example, ensuring quality standards align approach across agencies. And second, it must also be clear about what it does not control. Each organization should still make its own programming decisions based on its mandate and funding. So by keeping this governance light, coordination could remain practical and useful rather than becoming bureaucratic. Localization, another important lesson relates to localization. We often talk about localization as a principle, but in practice, it only becomes necessary when national actors are able to influence decisions. In Iraq, transition creates opportunities to attend the role of national organizations. So this happened in several years. So that's why ICF has been built on that approach. Yes, next, please. As the context in Iraq developed, the role of NPCA also changed. NPCA is no longer seen as a single one-size-fits-all intervention. By 2023, NPCA became a smaller but more targeted company with broadened programming. But it still continues a very important role for certain population groups in specific locations in Iraq. But it's also used as a part of integrated programming that combines different types of support for the most vulnerable communities. Next slide, please. In Iraq, discussions within the Iraq Cash Forum identified four main methods that APCA can be positioned. First, it can be functioned as standalone humanitarian assistance. APCA can be integrated in durable solutions approach. Third, it can be worked or linked with the social protection systems with the government, where possible third and coordination or referral mechanisms with the government programs can be integrated. And the fourth, cash assistance can support to climate-related and displacement risk, including anticipatory action or adaptation measures. So this flexibility allows cash assistance to remain relevant even as the context evolves. Yes, last, I would like to thank you. To conclude that, before thanking, I would like to conclude, Iraq's experience shows that coordination can successfully evolving during transition period. So 3 lessons stand out from this presentation. First, start planning for transition early. Second, build on existing technical foundation rather than starting from zero or from scratch. And the third and last, make coordination inclusive so that national actors can play important role in this programming. And indeed, cash assistance remain an important tool, but its role must adapt to changing context within the national context. Thank you so much for your kind attention. I look forward to the discussion. Thank you. Over to you, Bilete.
So much, Cameron. The very good highlights and the importance of coordination and transition early, and the roles that local actors can actually play, and building on the foundations and the capacity and competency that's built over the years. So it's the Iraq example is a good one. Thank you so much for highlighting that. Yeah. Now we'll go to the next presentation. Our next presenter is Hussein Barish. He's a project manager of field operations at World Vision Syria Response. He will share us on the role the local partnering, local actors actually play in our responses. So Hussein, over to you.
Thanks a million, dear Bilete. Good afternoon, colleagues. Here I am, Hussein Barish, project manager from Syria Response. And today, really, I would like to start by thanking all of you for this opportunity. I have a lot to tell, but less time to go through because, our time is limited for each speaker. So I'm just going to try to be quickly during my presentation. Today, from crisis to resilience, the role of CVA, and I'm started by explaining the photo you see in my presentation. It's one of our targeted camps in north of West Syria, where we have partnered with WFP. And later on, during our presentation explanation, I'm going to talk more about our project. Next slide, please. For each response, we have mainly like 3 main responses, which we are going through. Short-term response through emergency response, mid-term through early recovery, and long-term through development. Unfortunately, the situation inside Syria keeps changing between emergency and early recovery. And until now, we didn't reach the stage of development. That's why situation keep going and changing. In Syria, after years of protected crisis, shrinking funding, and increasing needs, traditional in-kind models alone cannot carry us forward. For protected crisis, shrinking funding, and CVA became for us as a transition tool. This is where CVA became more than a modality, it became a transition tool for us. Next slide, please. As I already explained, like for short-term relief, I've put on long-term relief. To long-term relief resilience, we have multi-cycle integrated CVA support, not just as a survival, but as a recovery, because it shows that dignity, because it's market strengthening and multi-cycle design. Next slide, please. For the central role of local partners, in World Vision Syria Response, we have around 21 local partners. We are working with them either directly or indirectly. Some of them working in different sectors, or some of them specialized in different categories, such as like providing training, etc. So the central role of local partners for system holders, not just delivery channel. In the spirit of localization, the rest requires moving beyond participation towards shared decision-making, shared visibility, and shared risk, because it's community dynamic, access management, trust relationships, and system holders. Next slide, please. For risk sharing, not risk shifting. We have like two kinds of approaches while we are monitoring or implementing our projects with our partners. Old approach was like compliance burden pushed to local partners, fiduciary risk transfer downward, and donor regulation used as barrier. For new approach for risk sharing, we need to have a joint accountability framework, shared fiduciary oversight, and transparent financially systems. This is done through joint monitoring, co-design systems, and transparent oversight. This is how trust is built. Next slide, please. The evolving role of INGOs from implementer to enablers, for implementers doing the work directly, evolving to enablers, building other capacities, and this is done through where we have like CVA technical leaderships, financial controls, digital payment solution, and for sure we take into consideration data protection. Building institutional capacity, so Syrian NGOs, for example, can lead CVA independently and sustainability, but not by transferring risk, but transferring capability. Next slide, please. Also here we are talking about building the infrastructure for sustainable CVA, where we have, when CVA is strengthening local markets and institutions, it reduces dependency and reinforces community resilience through institutional CVA readiness, local financial system, multi-year investment, and market-based programming. Next slide, please. Here I'm going to talk about our one of our examples. We have like different examples from Syria Response about using CVA system in our projects, where we have it like for in-kind, where we have it in CBT, where we have it like for agriculture or food security or health. But here I'm gonna, because of time, I'm gonna highlight it just quickly for our partnership with WFP. We have a project called Food Security and Nutrition Assistance for Vulnerable Communities in North Syria. Next slide, please. In this project, with the objective of it enhancing food security and nutrition among vulnerable population through targeted response intervention. We have like three main responses. We have in-kind food rations, we have CBT for the same household, and we have nutrition component. Next slide, please. For WFP cash-based transfer in Syria, scale, dignity, and market resilience, we have large-scale market-based and digital system. In this project, we are targeting 15,000 households, around 75,000 individuals, of which 7,500 households through in-kind and 7,500 through CBT programming. And currently, because dependency and situation changes in Syria, so we are transiting from in-kind towards CBT 100% by June 2026. This transition is moving us for saving money, making people love and buy what they wish to need, because sometimes inside the food kits, people, they are always complaining they are not finding what they are looking for. So CBT is not just a response mechanism, it's a bridge from crisis management to resilience and system strengthening. Next slide, please. Here we have like key principles of CVA and humanitarian resilience. I'm not like gonna talk more about it, about just dignity, local leadership, and resilience building. Next slide, please. The path forward, like for CVA, must transfer power, not just assistance, from international control to local leadership, from fragmented intervention to system strengthening, and from crisis management towards resilience building. The humanitarian reset is not about doing less; it's about doing differently. Next slide, please. Here we like one photo of our CBT and CVA programming inside Syria, where we use it, for example, here for CVA for education, where we are supporting families of children to keep their children inside the school. Next slide, please. Here also like one photos of our supported schools inside Syria. And here we written, if we truly believe in localization, CVA must not only deliver assistance, it must transfer power. Next, please. And thanks for attending. That's all from my side. I just try to make it like a brief. Back to you, Bileti, and thanks a lot.
So much, Hussein. I think it's a very packed with a number of good things, and the localization is already happening, right? So that's basically what we can learn from Hussein's presentation. Number of partners, I think there were 21 partners, working with, and in some of those, shifts in the way we perceive localization itself. It's very important. It's about system holders. We need to we are enablers, risk sharing, those kind of things. And the reset is not about also doing less. That's very important one. So we need to do it differently, efficiently, effectively. So that's a very good one. Thank you for highlighting those key things, Hussein.
Appreciated this. Thanks, Emily.
Very good. So, and next we will go to Bangladesh. Rahat will again share the experience and CVA, and particularly in different, of course, in its different floods and cyclone happened there again, and how. As a cash working group lead, as World Vision and Rahat, and of course, and how we're also working with different partners in Bangladesh. So Rahat is the Humanitarian and Emergency Affairs Manager with World Vision Bangladesh. Rahat, over to you.
Thank you, Belete, and welcome everyone. I'm Rahat. I'm working as Humanitarian Emergency Affairs Manager for World Vision Bangladesh, and also I'm co-coordinator for National Cash Working Group, which is led by World Vision Bangladesh here. So today I'm sharing that how cash and voucher programming actually contributing towards the strengthening localization system in context of Bangladesh. Next slide, please. So if we think about the context of Bangladesh first, that we are living in a multi-hazard country and it's exposed different types of disaster in each and every year. So if we think about our location, if we see the map, the highest, the dark one, there's very high risk areas, and 78% of the population living in the high risk areas. And if we think from the Informed Risk Index matrix that it's marked as high risk, and it's predicted that by 2050, 20 million people will displaced due to climate change impact. Next slide, please. So if I particularly mention about the 2024 year 2024, when we affected by several multi-hazards and multi-disaster situation, when 18.4 million people affected, is almost 45% of the total population. Next slide, please. So when the maximum people affected in a disaster and crisis situation in Bangladesh, how the organization adopt the situation and how they respond. So from response perspective, each of the organization, not only the international organization, but national and local organization also, they work together, they come together in under the same umbrella, and actually they try to save the life of people who are affected by different disasters. So here, as an intervention, they prefer to have the cash and voucher program, as cash and voucher program is not a tools, not a assistive tools, but Bangladesh always divided and ensured a system that cash and voucher program can ensure for the affected people through a localized and through a balanced humanitarian response process. So why Bangladesh is very ready and implementing this very effectively? If we see that the strong enabling environment, Bangladesh has a very high mobile financial service providers, and they have a very good network. And always the development organization, humanitarian organization, prefer to facilitate the mobile money transfer rather the cash, handling the direct cash, as there are lots of risks associated with that. And if we think about the local market is very active after disaster. It's quickly reactive after disaster situation, and cash programming is very easy to handle in this situation. And if we think and prefer about the capacity of organizations, they actually are more capacitated nowadays, who facilitate the cash intervention for the community, which is faster, efficient, by ensure quality and ensure accountability. And always people prefer to have the cash as intervention, as it's a very useful for them to survival, as well as not survival situation, but as always then recovery phase also to restore their livelihood. They ensure their sectoral system, their shelter, each and every sectors, cash actually intervening and supporting them. So with that, the policy alignment is also a factor that actually creating the enabling environment. The government and local government is very supporting to that, to how that they coordination and local government coordination. They are emphasizing that how the organization will work with they do their endorsement. They always support. They ensure the beneficiary are actively participating in joining. So these types of intervention, they are also handling and own the process. Next slide, please. If we see the 2024 response, then for an example, there are 2.031 billion Bangladeshi taka dispersed through cash transfer and cash programming. And it's not only distributed as multi-purpose cash, it's actually distributed as cash for work, as the sectoral cash grants, as the livelihood cash grants for restoring their livelihood. So different sectoral intervention, the cash program actually covered. And here, if we see in the right side that in whatever the intervention they took, almost 3,000, more than 3,000 initiatives, small and big initiative, response and recovery initiative organizations has taken. And there 62% actually led by national and local organization. So the cash intervention, and most of the organization choose the cash intervention for the affected community. So it's not about that only the international organization and United Nations actually keeping the cash in hand. As per the Grand Bargain commitment, national organization and local organization is mostly handling the cash in the Bangladeshi context. Next slide, please. So if we see that what is driving that localization agenda, it's not about that only localization, local organization is working as the implementer. So it's a vice versa. It's a balanced relationship and balanced positioning. So if we see that in localization is all about the balanced humanitarian response, and of local organization, national organization, international organization, even donor commitment also should have for localization. So for local organization, they are not working as implementers. They are the decision makers. They are the actor who accessing the community directly, and who are bridging from donor to community, and always through international organization, even not always through international organization, as leaded by them directly. So here, if we think that from three perspectives, that shared risk management, international organization and local organization, they work together in sharing risk management related to cash. They are strengthening their capacity. So local organization, national organization, always getting capacity building support from different international organizations and UN to facilitate that cash intervention effectively. And they are maintaining the accountability and their complaint response mechanism. And they have whenever the gap, they're working together and mitigating that. And if we think about the partnership with local actors, it actually they are the owner of making this partnership. The community accessibility and contextual knowledge the local organization have, and they are promoting that, and people creating accessibility to reach the organization towards the affected community. Next slide, please. if we think about that, how international organization is supporting localization, if I share experience for World Vision Bangladesh, from 2020 to 2025, we actually invested 165.23 million USD as cash intervention. So cash intervention is prime for our World Vision Bangladesh programming, and maximum cash intervention we channelized and we reached to the community through our local and national partners. So some of the national partners work like BNK, Sundan Shangho Resource Integration Center, who are actually our core partners who mobilize that support to the community. And if we give an example in 2024 that Noakhali flash flood happened, that time, interestingly, we didn't have any presence in the locality where the flash flood happened. It was very sudden, and the location was not affected before for flood. But this is the first time they affected for flood, and we didn't have presence there. But our partner, RIC, has presence there, and through them, we worked together, we designed our plan, we approached to the donor, we get the fund, and we reached to the community within very short time, within 7 to 10 days, as I can share that we reach to the community and support them. So this is the example that how local partnership and localization can reach together to the community effectively, very quick, and when required. So within that experience, I'm just sharing that World Vision is working as the national cash working group, leading the National Cash Working Group in partnership with UNRC. And in this cash working group, we are maintaining that local organizations' representations, their voice, we are working together, and we are trying to promote the humanitarian coordination regarding cash-based program intervention in the Bangladesh national practices, that it can be based on the balance, and it can be create an example of how we belong together and work together for the effective CVP programming. So key lesson, if we can share that, of course, the localization initiative and the CVP can influence a more effective humanitarian system where that we can ensure the faster dignified assistance, we can ensure the local leadership, and we can build the trust, and we can develop a digital ecosystem that cash can reach to the people as soon as possible, as well as the local leaders, local organization can enhance their capacity and be stand for the community who need them. Next slide, please. Thank you. That's all from my end. If you have any question, you can share in the chat. I'll try to answer. Thank you. Over to Bilata.
Thank you so much, Rahat. Thank you. Yeah, again, I think it's interesting lessons, particularly how Bangladesh and other partners in Bangladesh are actually working with local partners. The percentage that they mentioned, the co-designing and the co-delivering parts, and how trust has built over the years. I think those are really important lesson. Of course, the digital aspect of it, some of the contexts that, in Bangladesh and other contexts, of course, it adds value toward this efficiency and effectiveness as well. So thank you so much for highlighting the key lessons from Bangladesh experience, Rahat. So we will transition into a question and answer. I'm not sure how many questions we have there, but I will hand over to Manal to help us facilitate this session for the next maybe around 20 minutes. Manal is a Deputy Regional Representative for the Middle East and North Africa at the CALP network. Manal, over to you.
Thank you, Bilate, and thank you for all the speakers for their insightful presentations. We're a bit stranded with time, so we'll have a quick 10 minutes of Q&A. And I will start my first question actually directed to Kate. Kate, we had one of the questions asking, they understand with less money available, the absolute value of cash expenditures also decreases. Is there an analysis of why the share of cash approaches in total humanitarian aid has declined in recent years?
Yeah, no, thank you. Thanks, Manal. I'll be quick because I know others have questions too. I think 2 or 3 things to say is that graph obviously presents a global picture. I think probably influencing the shape of that global picture is actually that from 2023-24, we kind of scaled back big cash-heavy humanitarian crisis responses in places like Ukraine lost ground. Obviously, Turkey was a huge cash after the earthquake. So those big programs, which were cash heavy, once they stopped, I think that influenced the overall data, which then started to decline. So I think that's partly the question. The second element, I think, is that that I guess when resource cuts came along, cash, which had been easy to scale up because it's quick, rapid, agile, you can expand it quite quickly, was also easy to cut. So when programs and donors were faced with difficult decisions around what to cut, cash was actually quite easy to scale back. If you've got a big food aid program, you've got logistics in play, of course, it's much harder. Or if you've got a kind of ongoing long-term sector response, health, education. So I think there was a scale factor for cash in terms of it became quite easy to cut in the face of those resource constraints. However, and I think the important point to end on is I think, although those are the global pictures, I think we are increasingly starting to look as CALP and as partners around what's happening across different countries. We're looking at the humanitarian response plans this year, and we're looking at what's happening. We do see places where cash is still making progress or holding its ground and making progress. So I think it's really important to look beneath those global figures and understand what's happening in our particular crises, in our particular country context, and then obviously make sure that we're understanding where those trajectories are, seeing those opportunities, and digging into the specificity of different crises. So that's a bit of an overall sense of, yes, we should be concerned, and we should all be really kind of making that case for cash at the global level. But also, once we're working on specific context, let's really understand what's happening and how we can really build on progress that we're making.
Thank you very much, Kate. We'll move on to our next question to Tata on the research of the cash waves is how accountability to affected population can be leveraged to make CVA more impactful. Tata, you're muted.
Yeah, thanks so much. This is a great question, and definitely something that we as a sector need to be exploring and leveraging more, because listening and hearing directly from the communities that we serve will first of all help us to improve the relevance of our programming, so engaging them at the design stage, but also hearing, having strong systems of getting feedback. And then also I would say targeting that, hearing directly and involving communities in the targeting process, developing targeting criteria, which could lead to the great outcomes. But if we get wrong, I think across the presentations we've heard today, that how wrong or poor targeting can lead to inadequate results under the CVA programming. So direct engagement across all stages of the CVA program would be something that we all need to do better as we move forward, and as we want to position CVA as a stronger resilience tool and not just a one-time assistance in emergency contexts. Thank you.
Thank you, Tata. And if I could ask with for Rahat on her last research report, kind of when you were talking about CVA for durable solutions, are you talking mainly about sectoral cash or cash used within other sectors? Or is it possible to have CVA as MPCA for durable solution?
Yes, CVA, I mentioned about that total CVA. It's not about the sectoral CVA. So CVA is different types of CVA. I mentioned that multipurpose cash grants, cash for work, and even the sectoral support what can be used for livelihood cash grants, shelter cash grants. So different types of cash I talked about, but mainly is different cash-based intervention. Can be for direct cash or mobile money transfer, or can transfer the cash and voucher program also through. And I think that in Bangladesh context, CVA practicing is very common here as the humanitarian assistive things, as because the community prefer to get the CVA, and it's of course can be a durable solution because CVA, we actually provide the CVA based on different contexts. So when the emergency happen, we initially provide CVA support for their just life-saving assistive things. But when it's come to the recovery phase or after that, we actually change the modality. Sometimes we provide the cash for work support, sometimes I provide the sectoral support. So it depends. But each of the intervention, what types of CVA we will do, it depends on the context and requirement of the community. So community preference and the dignified way how they are preferred to receive and how they are actually utilizing the cash, these all are monitored and analyzed by the organization. So it's a of course durable solution for Bangladesh, and it's very effective tools till now for any humanitarian response. Thank you.
Thank you very much, Rahat, for your answers. We're going to take one last question, and it's quite a broad question, so I'm going to kind of present it for anybody that would like to come in with an answer from the speakers, which is, in fragile and volatile contexts, how can cash and voucher assistance be used not just for immediate relief, but as a strategic tool to build local resilience and reduce long-term aid dependency? No, it kind of sums up a lot of our discussions with the cash. I don't know if Kate or Tata, you would like to come in as kind of final answers with the Q&A.
Maybe, I mean, I think a couple of thoughts. I mean, I think there's so much learning from across the region on this. I think, I mean, the obvious point is that obviously building your kind of response, but taking into account that longer term social protection outcome, that transition to social protection, so building on what's already there is obviously the obvious lesson. So I think there's lots of lessons around the systems. I guess the one thing that keeps me a little bit awake at night is this challenge of how we give meaningful value, meaningful levels of transfer to households. So, you know, so often we're constrained by resources, we have an overwhelming kind of set of needs, that we're faced with those difficult choices of the level, the value of transfers, whether they're sectoral, multi-purpose cash, basic needs, and all those things. And the thing, I guess, that really for me sometimes undermines the contribution to that longer term resilience is that the value of the transfer is not sufficient to kind of enable households to have that resources to invest in livelihoods and kind of more productive outcomes. So I think we're really stuck with this kind of how much is meaningful in terms of these very difficult contexts when we've got, you know, challenges around resources. So it's probably, you know, I think to have a healthy discussion around the level of transfer, the frequency of transfer, whether the transfers happen in one lump sum or, you know, staggered in smaller amounts. Those are really important practical questions I think we should be talking about if we really want to use cash to drive resilience outcomes, as well as all the good conversations we're having around linking to systems and the longer term systems. And in fact, all the points that Cameron raised from the Iraq experience are extremely relevant to that conversation too.
We just to very quickly add a couple of points, and I agree to everything like Kate just mentioned. And then also predictable cash. I think this is critical for the communities. It's critical for us as we plan our programming, but even more so for the communities that receive cash assistance, that it's longer term and predictable, so they can plan around the other investments, other interventions and interactions based on that. And then also, as I've said, I think multiple times, layering with the different other interventions, other approaches that calls for a better coordination across different organizations that also work with the same target groups. Thank you.
Thank you, Tata. I think I'm very conscious of time. So with this, we'll close the session of the Q&A. I would like to also ask the speakers, there are a couple of questions in the Q&A that we didn't get to, so it would be great if you can answer them. And with that, I'll hand it over to Bilete.
Thank you so much, Manal, and yes, all the colleagues who responded to the questions. Yeah, just to add on that point, and just to make sure that we in a fragile context, we're doing cash, right? Including now in Sudan, what's happening in many places where we always assume that it's very difficult. But I think the question is also very relevant. How can we link that? It's not just delivering multipurpose cash. How can we link and empower the affected communities towards resilience building? So I think that's a good question. Of course, different contexts could be different in response to that. But I think, if we are intentional from the beginning, and I think we can start doing, different things. And one is the financial inclusion aspect that we all talk about. Of course, opening bank account or have digital, wallets is one thing. But then how can we link that with different services available based on, of course, the context? And, could be organizing them as saving groups or even linking them with financial service providers, including microfinances. And I think we have seen that in our Myanmar response, for example, recovery lending, that integrating that, with the MPCA kind of intervention, the financial literacy piece that we can actually do. There are quite a number of things that we can do. And I think we just need to be intentional from the beginning. While we respond and meeting the basic needs, we can actually also explore ways to start building resilience, at least where they come from. They have capabilities, they have assets, they have experiences, and we just need to be intentional. So just want to highlight that piece for that specific question. So yeah, we have a few minutes left to conclude. I just want to say a few things, and we'll conclude with that. Just try to summarize really quite a number of important, relevant topics that fits well with the topic that we chose: humanitarian reset, from crisis to resilience. I think, as you can see, number of good topics already covered. Looking at the overall where we are, of course, resource decline, but the importance of also re-looking at our own strategies to approach that. The importance of focusing on scaling up and amplifying in cash. So those are things that we've covered. Of course, we look at the efficiency aspect of it, but it still is very important. I think that's a good evidence to continue to advocate for cash. We looked at impact and not only MEPCA, but also building resilience. I think we should not miss that opportunity, and using that even for advocacy. This is not the time we just archive the different evidence that we have. It is a time to invest on them. It's a time to leverage those evidences that we built over the years and perhaps advocate at different levels. And I think that's very important. Coordination, we looked at it, the importance of coordination and the importance of local actors in that coordination structure. And even as we transition, it's very important that we do it right and we start from the beginning. And of course, from Syria and Bangladesh, we've looked at the importance of working with local actors, the localization piece. In practice, it is already happening as we learn from those countries. It's not just only to deliver in a difficult contexts, but rather they are truly partners, and we need to empower them. They are part of the system. They are the ones who will continue even after we left. So that intentionality is very, very important. Yes. MEPCA or multi-purpose cash assistance, or just to meet the basic needs of affected population, it's a very critical modality. We need to continue to use that in emergency responses. But also, as we looked at it, it's also important to look at sectoral cash. If we link that, we can maximize impact. And I think we looked at that piece, digital where possible, that adds value towards efficiency in different risk management pieces that we've been looking at, and of course, partnering, working with local partners, working with them, empowering them is something that we looked at. So I just want to conclude with this summary, and I just want to thank you all for the presentations and sharing your experiences, colleagues from the field offices, regional offices, from CALP, and from World Vision. And of course, for all of you joining us today to hear and of course learn from these experiences. And the dialogue need to continue, and the research will continue, and will continue to do cash and cash at scale where it is feasible. Thank you so much, colleagues. With that note, we'll end our sessions today. Bye-bye.